Hi, it's Dr. Z. In this section, I will be describing anxiety and anxiety-related disorders. By the end of this video, you will have an understanding of the most common anxiety disorders listed here. Please feel free to pause the video at any time to take notes. Well, what does anxiety look like? We all experience anxiety. Worry about getting an A on the next exam or assignment, worry about the future, worry about eating either at Chick-fil-A or In-N-Out. Anxiety is normal to a degree. Anxiety can develop into an anxiety disorder when the anxiety becomes irrational, uncontrollable, and disruptive to everyday functioning. Anxiety disorders as a group, are characterized by uncontrollable and disruptive fears or worry. Additionally, anxiety disorders feature physical symptoms such as motor tension, hyperactivity, and worrisome expectations or thoughts. Now, the Jumpstart question asks you about panic attacks. How would you describe a panic attack? Trouble breathing, heart racing, panic, fear? Is your heart going to explode? Yes, you've described a panic attack, which is an episode of overwhelming anxiety, fear, or terror. Now, to be clear, panic attacks are not a disorder itself. It is a symptom of an anxiety disorder. Now, I will discuss common anxiety disorders. Generalized anxiety disorder. The word generalized tells you a lot right there. Anxiety here is generalized to all possible situations. The worry is persistent and chronic about every little thing, and this worry lasts for 6 months or more. The worry is also unfounded or greatly exaggerated. Additionally, individuals with generalized anxiety disorder often experience physical symptoms such as muscle tension, trembling, sweating, heart racing, nausea, and even gastrointestinal or stomach issues. The photo here is of the main character in Analyze This, who appears to be experiencing generalized anxiety disorder as a result of a personal traumatic event. Panic disorder. Individuals experience recurrent, sudden onsets of intense terror or panic. Get it? Panic disorder. These episodes of panic often occur without warning and with no specific cause. The photo here is of Ambrose Monk from the TV show Monk. Ambrose has a panic disorder that results in him being unable to leave his house. Now, most people get panic disorder and agoraphobia confused. Most students incorrectly assume that agoraphobia is the fear of going outside. Thus, an individual never leaves their home. Rather, individuals experience an intense fear of not having help when experiencing a panic attack. So, being in a car or an elevator is a location where you cannot escape or get help if you had a panic attack. So if you think about it, an individual's home is a safe place where they know they can get help and there's no need to ever escape their own home. So individuals with agoraphobia prefer to not leave their homes. The photo here is of Ambrose Monk's home in the TV show. Specific phobias. These phobias involve an irrational, overwhelming, persistent fear of a particular object or situation. Often, these objects or situations pose little to no real danger. This photo of Indiana Jones unexpectedly having to face his fear of snakes is an example of a snake phobia. Now to social anxiety disorder. This anxiety disorder is also known as social phobia, which involves an intense fear of being humiliated or embarrassed in social situations. The photo here is of the film Lars and the Real Girl, where the main character has a severe case of social anxiety disorder. Now to obsessive-compulsive disorder. This is also known as OCD. This disorder involves a person who suffers from recurrent obsessions and/or compulsions. Obsessions are recurrent involuntary thoughts that cause distress. The word thoughts here is in bold because obsessions have to do with thoughts, whereas compulsions are recurrent irrational behaviors to perform an act or ritual repeatedly. Here, the word behavior is in bold because compulsions are a behavior. So if you think about it this way, it is the anxious thoughts, the obsessions, that cause distress. Then the compulsive behavior temporarily relieves the distress. This individuals diagnosed with OCD constantly repeat the compulsions, even knowing that the compulsive behavior is irrational. The photo here is of the TV character Adrian Monk, who has persistent compulsions to have items arranged in an orderly fashion. In summary, anxiety disorders are characterized by uncontrollable and disruptive fears or worry. Understanding anxiety disorders is the first step in helping individuals who are experiencing these type of symptoms. The photos and GIFs used in this video are property of the above-mentioned films and TV show.